Hello, I'm Deborah Chieli, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spell, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally, and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole-person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview. Today's guest is Dr. David Donohue. He's been practicing primary care internal medicine for over 20 years, and he's co-owner and chief medical officer of Progressive Healthcare of Delaware, which is arguably the most successful lifestyle medicine clinic in the U.S. He is a true lifestyle medicine trailblazer, transforming his passion for people and planet into a highly sought after practice with numerous providers, all focused on treating the root cause of chronic disease with lifestyle interventions. He and his entire team are an example of what any of us can achieve in lifestyle medicine, paving the way for success both clinically and financially. And with this in mind, he co-founded Poplar Care, which is the nation's lifestyle medicine network. He's active in the American College of Lifestyle Medicine, where since 2018, he's chaired the Provider Network Member Interest Group, leading the way for others with the same passion and perseverance that he himself has. An essential part of his medical practice is the utilization of nurses, so both registered nurses and nurse practitioners working at the top of their education, training, and scope of practice to help bring his vision to fruition, and we're going to dive into that a bit today. I came to know Dr. Donohue from seeing a presentation at the ACLM conference in 2022, where I approached him and said, I'd love to have you on my podcast, which he graciously did. You've been generous. And so I'm going to turn it over to Deborah very quickly to just chime in a little bit, and then we'll get started.
And I would love to share that I met Dr. David Donohue back in 2018 in Indianapolis, and that Dr. Donohue, you were instrumental in my engagement in lifestyle medicine, ACLM, and in clinical practice. I had the pleasure and joy of being with you for 2 pre-conference workshops, along with Dr. Wayne Deisinger. I believe that was on shared medical appointments and incorporating into clinical practice. And then along with Susie, we were both wowed by your workshop last year that you did with your team, Protocols to Standardized Care. We came away with many practices and resources that you shared with us along with your team. So thank you. It's great to be here with you.
Wow, it's great to be here with you, Deborah and Susie. Thanks for that over-the-top introduction. That was very kind of you. So I'm delighted to talk with both of you guys.
Thank you very much. So we'll dive in. Can you just tell us, if somebody is seeing this video for the first time and they've never heard any of us or seen you, can you tell us a little bit about your background as far as like your lifestyle medicine story, how you discovered it, began practicing it and how it's grown?
Yeah, I'm a primary care doc. I studied internal medicine, and am very much a traditionally trained physician, graduated from American Medical School, Baylor College of Medicine. But in the course of trying to help my patients as best I could, it occurred to me that there's more we can do than traditional approaches to diseases. And so disease management became really a frustration for me, because it felt like I was just kicking the can down the road and not really helping. And when you review the literature and the science around how effective are these drugs, most people come in to see the doctor and they're on 12, 15 drugs. It gets out of hand, and you think, what's the value of the drugs? And in many cases, clearly all the medications have valid science that shows how effective they are. But oftentimes, the dirty little secret is that they're not very effective, like just a little bit of incremental effects, and not nearly the promise that we can achieve when we treat the root cause of disease. And so as I studied the literature and the science out there of what can we do to treat the root cause, the recurring answer is lifestyle. There's thousands and thousands of papers demonstrating the value of lifestyle for preventing and even reversing chronic disease. So then I came to discover the field of lifestyle medicine and the American College of Lifestyle Medicine, which is such an effective professional group at the lead of this field of lifestyle medicine. And my goodness, did I find my home. It's such a wonderful organization, so supportive, and really founded around the science of how can we treat the root cause of disease. And so I'm thoroughly grounded in the science. I will go whatever direction the preponderance of evidence will take me. And that's pretty much where the science takes me, is that healthy lifestyle, healthy diet plays such a role in people's lives. And so I've incorporated it into my practice starting quite a few years ago now, and saw amazing results. And when people make the changes, the results happen. It's fairly guaranteed process that if you make sufficient changes, you're going to see some results. We can't predict the degree of reversal of disease for every single person, but we see a lot of benefit, and it's really life-changing, mind-blowing kinds of results that are possible. So once you've learned this, you can't unlearn it, and you have to incorporate it into your life's mission. That was my conclusion.
Yes, and that was my conclusion as well. Probably Deborah's too, if I had to guess. So what I would like to know, can you tell us a little bit about your practice specifically, and then just about your practice in general, and then how you're using nurses in your practice?
Our practice is called Progressive Health of Delaware. We're a primary care practice that's been in operation since 2003. And we've always been a high value practice. Like we try to do the traditional internal medicine thing of addressing every problem for every patient every time. Obviously that gets a little out of hand, but we do our best. So we've always done like 30-minute office visits, and we've incorporated the best that we could to treat the root cause. As we just learned about the field of lifestyle medicine, we made that more of our official policy, our official way of treating people, is to make sure we treat the root cause when possible. In other words, if you come to see us with type 2 diabetes, you're not going to walk out without hearing quite a bit about diet, quite a bit about exercise, and we're going to ask you about your sleep. So we're going to check those boxes, whereas most of our healthcare system misses that boat. And so I've had the opportunity to connect with a lot of lifestyle medicine docs around the country and trying to find other like-minded practices. And there's quite a few out there, but I haven't found any as large as ours. We have about 15 full-time providers. We have 4 nurse practitioners at this stage, although we're hiring 2 more. We have 8 physician assistants and 3 or 4 docs working for us. So we're a pretty large practice. We also have a care team, and the care team consists of registered nurses who act as the leaders of the care team. Then we have some care navigators who are medical assistant trained, but very gifted at maintaining a panel of patients. And then we have some health and wellness coaches, certified health and wellness coaches on the care team. So those 3 roles on our care team, and that care team collectively engages with our Medicare patients to keep them as healthy as possible.
That's great. You said, if I heard you correctly, 4 nurse practitioners, but hiring a couple more. And you also have RN leaders on your care team. So I feel like the nurse practitioner role is pretty clear, but I would love for you to talk a little bit about the RN leaders also, because we're all trying to figure out how we can utilize and practice to the top of our scope. So can you give us some examples of how the nurses in your practice, the RNs specifically, are working in your practice?
Yeah, absolutely. This is something I'm passionate about because it was an epiphany when we brought on nurses first into our practice, which was about 5 years ago. And so until that moment, we, like most medical practices, didn't have any nurses. And what we brought on, we now have 3 nurses. What kinds of things they're doing, they have so much value to add to primary care. Classically in primary care, they don't play a role because they're not able to bill for office visits. So they're systematically excluded from a lot of healthcare, especially clearly in an outpatient setting. But what we brought them on to do is they fulfill all these different roles that are so valuable. One of the roles they do is triage of incoming phone calls. So people call, I'm not feeling well, and our office wants to effectively triage that message and make sure that phone call and make sure that we're treating them appropriately. Is this something that needs urgent admission, urgent appointment? And we always keep some slots open. Is this something where this person needs to go to the emergency department? Should we route this to the care navigator? So that's where the triage comes in. Another key area that nurses have been able to fulfill for us is what I call inbox triage or inbox management. And what that involves is, as a PCP, we get overwhelmed with incoming messages in our inbox, in the electronic medical record. These messages could be reports, lab reports, maybe portal messages from the patients, but it's just, you just get slammed. And your reward for having a busy half day of seeing patients is you sit down at your desk and you're overloaded with inbox messages. It just makes the job unsustainable. So people burn out. And so we brought them in to parse through those messages and take care of the things they can take care of, to slim down that inbox and make the job of the PCPs more sustainable. So that's so popular with our PCPs that there would be mutiny if we tried to stop that. In fact, during COVID, we tried to pull some of our nurses back from that role and to fill the needed role in the clinic, but the providers were not going to have it. Another key role that they do is supervising the care navigators. And so they lead weekly care team meetings to make sure everybody's coordinated on the same page. There's a lifestyle check-in each time they're doing together. They're doing a sleep initiative together. They're doing a group nutritional intervention together. So they work really well together. And then the other things is coaching. So one of my nurses is also a health coach. So she does health coaching. And then finally, one of my nurses helps me with ITLC. So I have some really neat, I think neat, group programs that I run. We call it ITLC, which stands for Intensive Therapeutic Lifestyle Change. I recently ran a program I call Heal My High Blood Pressure, which was a 6-week ITLC, 1-hour sessions on Zoom. And my assistant was my trusty registered nurse colleague who was so helpful in handling so many of the aspects of running a group program and communicating with patients and the technical aspects and gathering data and also preparing the notes for me, so that made the whole ITLC doable for me, so that it wasn't too burdensome, sort of impossible to complete the task. So that kind of summarizes most of the roles and functions. I'm sure I'm forgetting some stuff. My goodness, they're designing handouts. When they perceive there's a need for a handout, they just made one on kidney stones, the nursing team. So there's, well, I didn't mention maybe the most important thing for value-based care, and that's case management. So this is a kind of a unique capability, I think, of the registered nurses on our team, is they each manage a panel of our sickest patients and try to keep them healthy, safe, at home, avoid hospitalization if we can. And so this is where, since our practice is on value-based contracting through our ACO network, the Poplar, we are getting paid to keep people out of the hospital and keep them healthy and keep them low cost. And so the nurses have taken on the role of tracking our sickest patients, our most at-risk patients, and they're doing things like they know everybody in the family on a first name basis. Everybody's got their cell phone contact, so they're reaching out on a sometimes even daily basis with these patients to basically be their best medical friend and identify every little leading indicator and risk that might be emerging. So it's a lot. It is a lot of things that our nurses are doing, and every one of them is vital, and we would never go back.
That sounds awfully amazing. So I heard you say a number of things. I'm going to recap them. The nurse triage role, the inbox triage or management role, the supervising the care navigators, who are the MA care navigators, and also doing a lot of initiatives with them. Also some content creation when the need arises, health coaching, an RN health coach, and your right-hand person as far as your ITLC helper who helps you run and maintain that particular program of intensive therapeutic lifestyle intervention. And so that is a lot. And the case management, of course. So that's a ton of things. And I'm curious your perspective or how you can explain to us with the value-based care, if RNs are not billing for their services directly, or is there anything that they can bill, even like a low-level bill, or is everything folded into what the provider is able to do because of their work?
Yeah, so there's a couple ways that they're bringing in monetary value. One is billing for CCM time, chronic care management time. So that's generally available for original Medicare insured patients. And so those folks who agree to chronic care management and have 2 or more chronic conditions are eligible. And we then log the minutes that we spend, and the nurses log the minutes they spend doing whatever is needed in the service of those patients' chronic and life-threatening diseases. Anything, talking to the loved ones about the plan for when the person gets discharged and things of that nature. There's some nuances to billing for CM. You can't do it when the person's in the hospital. So some of their time is billable, some of it's not. But the important point is that a nurse can actually just about pay for herself monetarily with CM. So imagine having someone so talented in the office who's basically free in terms of cost to the practice. I say, why not load up on as many nurses as you can get? Good luck finding nurses because they're so sought after. And then the other way is the indirect way that they bring in revenue. And that's by keeping people out of the hospital, you're reducing cost. And so when it comes time to get your value-based payment, your patients were less costly because you took such good proactive care of them.
Yeah, that's great. Thank you for that explanation. Deborah, would you like to take it over a little bit and talk to us a little bit about nursing, like the ethics and the different things like that, our call to action from the National Academies of Medicine?
Here. Sure. Thank you so much. One of the things that Susie and I are really interested in doing is bringing communities together, as you do with teams and your work across the country to help make all of this possible. There's an amazing paper, landmark paper by the National Academy of Medicine, the landmark report, Future of Nursing 2020-2030, charting a path to achieve health equity. Having listened to some of your interviews in the past, we know that's really a key concern for you is the health equity part and social disparities. And this calls on nurses and those in clinical settings, hospitals, education, government, to make it possible for nurses to do what you're doing right there in your clinic, which is for them to practice at the top of their scope of practice, at the top of their license. And one quick quote from that is that nurses are trusted bridge builders who champion good health for all. They're calling for everyone to explore how we can and must unleash the power of the nurse to achieve health equity, and how the systems that nurses function in can do more to employ, educate, pay, and support them. You're clearly doing that there at Poplar, Dr. Donohue. Wondering if you can speak to what, from your perspective of what's that call to action and the uptake of the power of lifestyle medicine that all of us in this space are so passionate about, and where we may need to build some additional bridges, what we might do to synergize that.
Oh, I'd be delighted. So our lead nurse is named, and she is, in addition to being an amazingly talented case manager and leader, she also actually has a background she has a private business even around as a consultant for reducing your healthcare costs. So she's actually got some certifications around that. So it's a fascinating skill set that she brings. And so we have some questionnaires around the social determinants and financial security and other things of that nature. But she is passionate about this and tries to visit this question, because one of the things that we're not often aware of when we interact with patients is the degree to which they're under a great deal of stress and maybe not cognating to the best of their ability because they are so stressed out because of some of these social determinants, including, for example, financial pressures. So many people are suffering from bankruptcy in this country or just unstable financial positions. Obviously, I can't summarize her wisdom in just a glib statement, but when I have spoken with her about this, it often comes down to eating plants. That's where we all in lifestyle medicine end up possibly far too often, but she just makes the point that obviously it's not going to cure everything, but it is a great way to shift the money that you're spending, because in her perspective, and she's got all these recipes and resources she shared, it saves a lot of money. And it saves money in future healthcare costs too. So it's such a win. And it doesn't require you to go join a gym or lay out cash in any other way. You just start shifting the foods you're putting in your mouth. And that is not the only solution, but a key solution that a lot of people overlook.
Thank you for that. And then following up on that, she has some special certifications there. And that's really powerful. Instead of paying for all those medications or an amputation or dialysis, just eat more plants. And she's showing that how her clients can do just that. Can I ask, do you ever find that there are concerns or objections to nurses educating patients about diet? That's one of the things that we hear often from nurses is, well, you're an advanced practice nurse, you can prescribe things, but I'm a nurse and I'm not a dietitian. We have in this mindset that nurses can work with wound vacs and give discharge instructions for very complex things and pumps and all of that. And we can tell someone, a nurse can tell someone about walking and sleep. But when it comes to diet, as you spoke, and just eat more plants, a lot of times nurses are given pushback from the network that they're in saying, you can't go near there. We'll have the doc or the dietitian do that. Can you share about how what your take on all of that in the scope of practice of nurses and what you do in your clinic every day with what your nurses do?
Absolutely. Some health systems are very risk averse. It sometimes tickles me some of the things that they prohibit their caregivers from doing. My goodness, the house is on fire right now. We need anybody who's got a bucket to throw something on that. We need everybody to help get people out of the house and fix the burning house. So we need all hands on deck. And I think a nurse knows how to practice within her scope or his scope. So clearly, and I don't think it's that far a leap to say eating fruits and vegetables. Let me talk to you and coach you through the process of figuring out how we're going to incorporate healthier eating into your diet. Absolutely, you can run into some advanced situations. Somebody's on dialysis, somebody's on insulin and having hypoglycemic episodes, low blood sugar episodes. But those waters are easily navigated. So to muzzle a nurse, who, by the way, nurses get more nutrition training than just about any other profession I'm aware of other than dietitians. So to muzzle a nurse but yet let a doctor who gets no nutrition training say whatever they want just doesn't make any sense at all. So what do our nurses do? They talk quite freely about ways of recipes and ways of eating more plants. And 99.9% of the time, that's going to benefit somebody's health dramatically. And nurses are going to identify those cases when they don't want to go there. 99.9% of the time, it's super low risk, super high benefit for nurses to go there and talk nutrition. And we certainly encourage and expect our nurses to do that much of their workday.
Thank you so much for that.
And you've just mentioned the house is burning. So I don't know if you would be willing to share with us just a little bit about the larger issues that we're facing in terms of planetary health and things like that. And Deborah also has another beautiful end statement about nurses and our call to be able to incorporate that larger picture of the global health and planetary health. So do you think you could just comment on that briefly?
Yeah, I believe, paraphrasing Greta Thunberg, our house is on fire, right? With regard to climate change. And we're recording this in mid-July. So this is at a time when there's 110-degree temperature every day for weeks. Down in the southwestern United States, we just had massive flooding, very devastating flooding in Vermont. And these kinds of catastrophes are happening on just about a weekly basis. And this is absolutely an aberration from the way things used to be in the United States and throughout the world. So do we need a wake-up call? The wake-up call came decades ago, but if we absolutely have to quit hitting the snooze button, and because a huge contributor to this is our food and the food system. So the fact that deforestation, well over 80% of the cause of deforestation in the Amazon is to make room or make products, feed for cattle. Cows are the real hogs, says the Union of Concerned Scientists. So we absolutely need to be moving away from beef from an environmental standpoint, but moving away from animal agriculture in general. It has such an outsized carbon footprint, and it also has an outsized footprint in terms of health damage. So one can eat responsibly animal products in the right quantities, and if you're selecting the right products, I don't know, baked chicken breast or certain fish can be an okay addition to one's diet. But the way we do it in the West is we eat way too much meat and animal products and processed and junk food, very much to the detriment of our health. Another form of processed junk food is palm oil. It doesn't get a lot of attention, but it's leading to a massive amount of deforestation in much of the world, especially Asia, Africa, and parts of South America. And that's displacing and basically some of our most cherished species like orangutans and pygmy elephants, et cetera, et cetera. The list goes on and on. There's a burning machine, with regard to climate change, there's a burning machine and a killing machine. And the burning machine is the thing everybody focuses on, which is let's drive electric cars and use wind and solar power instead of coal. And that's absolutely necessary. But there's also a killing machine, and the killing machine is our tendency to wipe out the world's habitats, to deforest, to kill wildlife and grow our own livestock instead. And that killing machine, according to some very knowledgeable people, is possibly as important as the burning machine, if not more, in terms of its impact now and into the future. When you burn down rainforest, you're not only releasing carbon right now, you're taking that rainforest offline from being the carbon sink that it traditionally was. So for many years into the future, you're going to impact this world that we're trying to raise our kids in. And by the way, nowadays, there are so many alternatives to beef, alternatives to meat that are plant-based and very much healthier. I'm not necessarily talking about Impossible Burgers or Beyond Burgers, but some of the other products that contain fiber and are rich in saturated fat, they're much healthier. There's such a win for the planet and for our own health. So I could go on, and I've already pontificated too much, Susie, but.
It's okay. I love it. I love hearing you talk about it because you're so passionate about it and so articulate about it and easy to understand when you just get on a roll. So I love that. Deborah has a quote. Deborah, can you read that quote, the one that we talked about prior? Will you read that to us so anybody listening can hear that quote, and so can Dr. Donohue?
Dr. Donohue, this comes from one of my most beloved books, which is the Code of Ethics for Nurses, those individuals, professionals that are in your practice that are getting to do the amazing work that they're doing because of your practice there. And the last paragraph of our code of ethics, which is on page 37, it's a lengthy document, says it begins, social justice extends beyond human health and being to the health and well-being of the natural world. And then the final, and it goes and describes it about environmental degradation and resources exploitation, ecosystem destruction. And then its final statement is that as nursing seeks to promote and restore health, prevent illness and injury, and alleviate pain and suffering, which is the nurse's mission, it does so within the holistic context of healing the world. And I get chills when I read that. I just did, but that is really what, if we just adopted that mindset, and we want you to know we are passionate about this as you. We are destroying our only home, and it's so easy to begin to fix it. And I think one of the things with even with mental health that we're seeing now, talking about climate anxiety, even I saw an article the other day about climate panic, is I can't fix the energy grid, but I can change what's on my plate tomorrow. And that you're a scientist, you follow the science. You said, wherever the science takes me, you look at the science, the Eat Lancet report and the Intergovernmental Panel, all of these reports are leading to this one conclusion, that we need to change what's on our plate, and what's on our plate is that's good for us and for the planet.
Yeah, I so embrace that. And I think that the key that needs to happen real soon is we need to take this knowledge that we have and put it into practice. We really need to move away from burgers and meatballs and just having a society that's built around beef and meat in general. But my goodness, a 37+ page code of ethics for nurses, calling on you to do hundreds of things. That sounds like nurses. I just wanted to say it aside, is like, I have the most respect for nurses. And there's a reason, I think, why our society has the most trust in nurses of any profession. And it's because of that, because you guys are people who actually want to heed the call of this massive document. And so much has been put on nurses to basically fix the world. I salute you guys for fighting for that mission. And the nurses I've had the opportunity to work with are absolutely delightful. I just wanted to give a shout out to you guys and thank you for the important work that you do. You and all the nurses out there.
Thank you so much for that. That's very nice to hear, the supportive words like that, because sometimes we just get into where we're doing our thing, and it's nice to hear that we do have that support from people like you. And I think to wrap up, unless you have something else, Deborah, a couple things. If there's anything that you want nurses, all nurses, RNs, educators, clinicians like NPs to know that we haven't talked about, anything like that, or also if you had a magic wand and to be able to tell nurses or encourage them to learn more about lifestyle medicine, or be able to have the confidence to run it up the flagpole or really pull it into their practice. Any tidbits?
Yeah, I would like to say something. I think nurses are possibly the most important educators in the world. And the reason I would say that is because nurses have, number one, are the most trusted profession. And number two, routinely, your job throughout your day is to interact with people who are really worried about their health. So you have those teachable moments. We talk of teachable moments, like people don't want to hear it if everything's fine, but when there's a problem, there's a teachable moment. So nurses have the opportunity of teachable moments throughout their workday, every day, almost every patient you interact with, whether it's in the hospital or in the outpatient setting or on the phone. These folks want to hear what you think, and you have a lot of power, and it is appropriate to tell them your opinions, that you likely wouldn't have needed this bypass surgery if you had shifted your diet. I know nurses will say these kinds of things with more sensitivity than that, but taking these teachable moments and really making use of them. And if I had a magic wand, I would wave the wand. And one of the many things I'd love to do with a magic wand would be to give people the sense of how powerful and how meaningful it is when you do change your lifestyle, when you change your diet, when you change your diet to a more planetary friendly, plant-based diet, It has the incredibly profound effects on our health. The science that supports this is incredibly robust. So it is not just you have this opportunity to give this life-changing message to patients, but it is arguably your responsibility to give patients this life-changing message. And you can find it somewhere in that 37 plus page document. And not that I want to add another mandate to you guys, because you have a million mandates, do all the nurses I've known. But anyway, bottom line is you have a lot of power, and I encourage you to use it.
Thank you for that. And actually, if we are able to get our patients healthier, just like for everyone on that healthcare team, how beautiful is that? You talked about the triple aims going now to 6 aims. And burnout, you retain nurses, they're taking better care of themselves, the patients are healthier, we're achieving health equity, all of that. And so it's like you said, it's a win-win. And in an earlier interview I saw with Susie, may I follow up and ask you, Dr. Donohue, are just brilliant and so generous at developing assets and saying, let's develop systems and ways to do things. We don't have to keep reinventing the wheel every time we sit down with someone for hypertension or fatty liver. We're hoping to come out of this 1 hour at ACLM at the conference with some handouts and some tools for people to take away. What would you advise, given your insight into all of this from so many levels? How would you advise us? What do you think would be really helpful to come out of this, from whether they're physicians there that are in attendance, educators, policy makers, nurses?
I would advise them to come to the American College of Lifestyle Medicine conference every year, or at least come in October to Denver, Colorado in 2023. Is there one place to go for information? My favorite resource is nutritionfacts.org. I've said this many times. I think it's a life-changing website. It is thousands of bite-sized 5-minute videos about the science of nutrition related to many topics. And in my opinion, it's a life-changing website. I tell patients, spend an hour on that website and you'll learn more nutrition information than most physicians are aware of, because we're not trained in that. Beyond that, like handouts or other resources, there's a hodgepodge of sources for that. There's no one go-to. We're building a library at Poplar of free resources, and we have micro certifications around, and we're building pathways, outpatient clinical care pathways based in lifestyle medicine and optimal traditional medicine for some of our biggest diseases like hypertension, diabetes, congestive heart failure, COPD, because there's so many things about managing and preventing these diseases that traditional medicine just does not engage with. And we're missing so many opportunities. It's a frustration for me when I look at the science around, just take an example of COPD, how this is not a preventable disease where the lungs can actually heal themselves if we stop the toxins from flowing into the body. And that comes in the form of certainly tobacco. It also comes in the form of PM 2.5 air pollution, which is becoming an increasingly important problem, as we've seen with the smoke that's been in the Northeast with the fires in Canada. And it also comes from nutrition. It turns out, who knew, the lungs are a vascular organ, and there's ample evidence that nutrition plays a big role. But most of our traditionally trained, the overwhelming majority of our traditionally trained doctors and pulmonary specialists, et cetera, never talk about nutrition. But it turns out that things like dairy, things like cured meats can harm the lungs, and things like fruits and vegetables and a whole food plant-based diet can very much heal the lungs and improve lung function. And this is something that medicine is just not embracing. And it's frustrating to me. You think of all the patients out there today with asthma, COPD, whose lungs potentially could get significantly better over time if they would shift their nutrition, if they would shift some of their other lifestyle practices, and they're just not getting this lifestyle information from anybody around them. So I probably went off on a tangent, but you're absolutely right. We need resources. We need to get that education out there to everybody. So I think nutritionfacts.org is a great place to start.
Thank you.
Thank you for that. And I know that you have to run, so we can wrap it up. And I thank you so much for spending this time with us. We really appreciate it. You are a beacon of hope in the lifestyle medicine world and nursing world. So
We really appreciate your wisdom and insight.
Susie, Deborah, you were two of my favorite nurses and colleagues from the American College of Lifestyle Medicine. So I always love to spend time with you both. And thanks for those kind words. And thanks for this important work you're doing. This is awesome. You're building a YouTube channel with trying to get this message out there to people. So bravo. Thank you.
Thank you for that.
Thank you, Dr. Donohue.
Okay, we'll let you go. Have a good rest of the day, okay?
Same to you. Bye now.
Okay, and
Thank you.
a
Thank
good
you.
trip.
Yes, yeah, just casually, just thank you so much. It's so wonderful to be here. And thank you for your wonderful work out there on behalf of all of this and leading the way with nurses. And so thank you for that.
I don't think I'm leading the way, but we just dipped our toe in the water with nurses, but more is yet to come for sure. We want to bring on board more for sure.
I think it's a good example of what people can be doing.
Yeah.
Yeah, and there's plenty others out there doing stuff with nurses too, but I'm delighted that, I would love to see more nurses get employed in this field of primary care and lifestyle medicine for sure.
Us too.
Yeah.
All right.
Good to see you guys. Take care.
Yes, you too.
Bye-bye.
Okay.
Bye
See you
now.
soon. All right. Bye-bye.
Bye-bye.
That was good. Here, I'm gonna hit
Yeah.
stop. I'm gonna stop record.